I want to introduce myself. I'm Dr. Richard Friedman. I'm a professor of clinical psychiatry at Weill Cornell Medical College, NewYork-Presbyterial Hospital. In an academic medical center, there are a lot of different things going on, research-wise, treatment-wise. The public really doesn't get an idea of what's going on. It's mystifying. It's just like wondering what's going on inside of a doctor's office. What we want to do in these podcasts is to bring you inside the institution, into the clinician's office, into the researcher's office, and give you a clear idea of exactly what's happening nowadays in the field. Up to this point, the public would learn about behavioral science and psychiatry from print media and from television, and now more and more people are turning to the internet to get information, including the latest developments in mental health. The average person who's searching and surfing through the internet can pull up all kinds of information, but doesn't really have a way to know whether what they're getting is accurate or trustworthy. And one of the reasons we're doing these podcasts is to really provide the public with accurate information about behavioral science coming from experts in the field who actually do this work. The public will be able to go to these podcasts and trust the information that they're getting. It's much more vivid, it's interactive, and it's direct. We can involve experts, we can involve patients, we can make this in a sense three-dimensional, unlike the written word on the printed page. Everybody who watches popular media is familiar with the fact that mental health professionals, psychiatrists, psychologists are portrayed in really very dramatic and sometimes inflammatory ways. What's exciting about the podcast is, for the first time, you're going to meet them up close and personal. To my knowledge, we're the first academic medical center to go into this area, the intersection with new media and behavioral science and psychiatry. This institution will draw on the resources and experts from a wide variety of institutions, from NewYork-Presbyterial Hospital to the Weill Medical College, to the Payne Whitney campus, to the Westchester campus. While we're going to do our best to provide you with current knowledge about topics in psychiatry, this is not medical advice. And if you're having a serious psychiatric problem, you really have to go see a doctor. We're going to talk about a wide variety of mental health issues, from new and controversial findings that you hear about in the media to bread and butter issues that are timeless in a sense. We're going to use a variety of different kinds of podcasts. Some will be audiovisual, some will be audios. We're going to directly interview patients, and we're going to do it in a way that protects their confidentiality. So these will be audio podcasts. We think that this adds a new dimension and gives a perspective to the public that's very different than just reading a report in the literature or hearing a report on television, because you're actually hearing a real live example from a patient who suffers from the problems that we're really talking about. So we have the clinical problem and then a discussion about what the problem is and how to treat it. There are a number of advantages to people who listen to the podcast. One, obviously, is that they gain a lot of knowledge about current psychiatric topics, but they also don't feel as isolated, and they recognize that the problems that they suffer from are common and lots of people have them. We're very excited to start these podcasts. We hope that they're going to be informative. We hope they're going to be lively and exciting. We hope that they're provocative, and we want you to respond, and we're very interested in your feedback and your comments and how you feel about them. You'll be able to turn this on and turn it off on demand. You can learn about the latest things in behavioral science wherever and whenever you want to. This is for everybody.